Hi there, it's Heather LaPaglia coming to talk to you guys today about tips to get your bladder under control. I am a licensed physical therapist and I've been practicing with Hoag for a while now, total about 9 years. And I want you to know that it's not normal, it's not in your head to have incontinence, and you don't have to live with it. So this is just a slide to show you we have 2 locations for Pelvic Health PT, one in Irvine and one in Newport. And this is what we're going to talk about today. We're going to define urinary incontinence, discuss how common it really is. We'll break it down into different types of incontinence and discuss the anatomy and physiology behind urination. We'll touch on some of the common causes of incontinence, and what's really exciting is we'll talk about some self-treatment that you can do on your own, be that Kegels, some dietary modifications, even lifestyle modifications. We'll talk about how physical therapy has a role in helping you with your incontinence and some other adjunct therapies that can be helpful. So what is urinary incontinence? By definition, it's the accidental or involuntary loss of urine that is either felt or seen. It can range from really rarely, a couple times a month, to several times a day, and full-on accidents. So how common is it really? Research shows us that 13 to 25 million Americans report urinary incontinence. You are not alone. 40% of women report leakage after childbirth and about 47% after a hysterectomy. It is more common that women will have urinary incontinence, but men can have it too, and I've treated several of them in my practice. Another study shows that 25% of elite female athletes report leakage at some point, so it's not just everyone over 50. And it can be experienced by about 40% of women who participate in any high-impact sport or activity, be that long-distance running or any other kind of high impact. So I want to bust some myths with you today. Number one, there's nothing you can do about it. That's simply not true. Pads or diapers are the only answer. Also not true. We have worked with a population from the range of 19 years old to 96-year-olds, and we have been able to help successfully improve people's continence to be totally dry. So the types of incontinence. The first type is stress incontinence. Stress incontinence is someone who says, I leak when I cough or sneeze, or when I pick up something heavy, and really just any activity that puts increased pressure on your bladder. And it can be small amounts of pressure over time. Urge incontinence is, I really got to go right now, and I've got to get to the bathroom, and I just don't make it. The urge is so intense. So leaking with an urge is urge urinary incontinence. Mixed incontinence is a combination of both of these, which we see commonly, and we'll talk a little bit more about that. So other symptoms that our patients have had that are associated with incontinence, we talked about urgency a little bit. That's the I gotta go right now. It's this sudden, overwhelming need to urinate. Frequency is a common one as well. These are the folks that you always know where the bathroom is. You map out your morning walk according to where there are stalls. And increased frequency is anything more than about 8 times a day, or more often than every 2 to 4 hours. Nocturia is another one that people have that are commonly associated with incontinence, and that's waking up 2 or more times a night to urinate. So let's talk about the anatomy of the urinary system a little bit. From what we can see in this photo, you have a picture on the left that shows sort of a person with this anatomy setup in situ, and then on the right it's kind of blown up a bit. So you can see the little kidney bean type of structures at the top are your kidneys, and you have ureters that flow all the way down into the bladder. So what happens is we're constantly producing urine from those kidneys based on what we're eating and drinking, and then that collection of urine filters down into the bladder and it slowly fills. When that bladder is about 2/3 of the way full, it initiates a stretch, and there's a nerve ending that detects that stretch. It signals your brain and says, I need to urinate. When we decide to void, the bladder is made up of what's called a detrusor muscle. And that detrusor muscle contracts. The pelvic floor muscles, which we'll go over soon, relax when you sit down and you urinate. and the urine empties the bladder, or is emptied from the bladder. So here is a little bit different of a view. We kind of talked about this. The bladder capacity is 300 to 400 milliliters. And you can see that we have this bulbous shape that's the bladder. So when we urinate, we sit down as females, or if you're standing as a male, the detrusor muscle contracts, and that intermediate layer you can see there is the pelvic floor muscles, and those relax, allowing the urine to exit the body. So the pelvic floor muscles are something we sort of touched on. These are what relax in order for us to urinate. So they're a group of muscles that sit at the base of your pelvis. So if you put, what's your pelvis? If you put your hands on your hips, kind of like you're being sassy, that's the top of your pelvis. And then if you move your hands to sit on your hands, that bony part on your bottom is the bottom of the pelvis. And between those two sit bones, running from front to back, is where your pelvic floor muscles reside. And they work closely with the bladder to really control urination. This is a look from the top, looking into the pelvic floor. And so this is the deeper layer. This layer plays more of a role in core stability. This helps support our organs to keep them inside of our bodies. They also provide sphincter control. That's what you'll see in this previous slide here. That triangular shaped group of muscles, sort of toward the front or the top of the photo, is going to be that outer layer, and they are what really serves that sphincteric function, urethral, and sexual function as well. Those pelvic floor muscles rhythmically contract to help with arousal and climax. You can appreciate, in addition to that, if we go back, around the anal region towards the bottom of the photo is where the external anal sphincter is, and that is what helps us with control of stool and gas. So in general, those pelvic floor functions are sexual function, sphincteric control, core stability, and supporting our pelvic viscera, meaning bladder, rectum, and uterus. So where can things go wrong that cause urinary incontinence? There's a whole list of things. So pelvic physical therapy, or this program we're going to tell you about today, may help you, it may not. And we'll talk about where to go from here if what we provide you isn't quite giving you the results you'd like. So first of all, we can have pelvic floor muscle weakness. If they're weak, then urine can exit and empty involuntarily. Diet and lifestyle can play a role. We'll talk about certain foods that can increase the sense that you need to urinate. Pelvic floor dysfunction, so it's not just about weakness. Sometimes people have a lot of tension in their pelvic floor, and that can create too inhibiting the function of the pelvic floor muscles, so you can't use them right when you need them. Pelvic organ prolapse can play a role. Your bladder can drop down into the vagina, and the urethra can as well, and that can affect your ability to hold back urine. Prostate size and status can affect urinary function. Cancer treatments, we do work with a lot of patients who have undergone prostatectomy or who have had radiation, and that can mess with the frequency that you urinate. It can affect the sensation surrounding urination and those kinds of things. Postpartum can be a big one during a vaginal delivery, and sometimes cesarean as well. Over the course of 10 months, you're holding all of that extra weight up, and that can put a lot of strain on your pelvic floor. And then with a vaginal delivery, you stress those muscles, and that can make it difficult for them to function as quickly or appropriately as they once did. Sometimes in other cases, when the baby's very large, we can have trauma to the pelvic floor muscles, such as tearing, or even some level of nerve damage. So not totally common, but can happen. Menopause. There's a lot of hormonal changes that happen with menopause, and that can change the quality and health of the vaginal tissue. Medical conditions. Some people have something called overactive bladder or diabetes, and sometimes your nerve endings can be affected. If you've had a stroke, if you have Parkinson's, or some kind of spinal cord injury. So there's a lot of variables that can contribute to urinary incontinence. I want to acknowledge that today, but we're going to focus on if your cause is from pelvic floor muscle weakness. So how do you strengthen your pelvic floor muscles? We'll go over how to do a pelvic floor contraction or a Kegel, but I want you to know that this strengthening regimen remains the first line of treatment for urinary incontinence. It's significantly supported in the medical literature and something I want to share with you. So I'm curious how many of you watching know how to do a Kegel, Because if I'm honest with you, our research says that about 50% of the people who think they're doing a Kegel correctly are actually doing it incorrectly. Be honest, how many of you are trying right now? So these are some cues that I want you to try to think about. I'll talk through them, and feel free to try to initiate a pelvic floor contraction and see how it feels. So one of the first things you can do is imagine stopping the flow of urine or preventing passing of gas. You can also think of zipping up the labia from the center of the perineum all the way up to the pubic bone, and so that you're sort of nodding the clitoris. Research shows us that activating in the periurethral area is often the most effective and commonly found in people who have full continence of urine. Another tip you can think of is trying to tuck the pubic bone and the tailbone together. Or you're thinking about bringing the front and back of that pelvis to pick up a marble and sucking it up through the vagina, through the rectum. For men, we found that common cues that seem to help are thinking about pulling the penis in. You can think about lifting the testicles like you walked in really cold water. Or if all of these are challenging for you as a female, and sometimes as male, you can lean forward in your chair so that your labia or testicles are resting further on the surface of whatever you're sitting on. And try to think about stopping the flow of urine, and you should feel like it's being lifted away from the surface that you're sitting on. I find that can be really helpful. Also, sitting on maybe a soft towel or one of those softer exercise balls can give you a little bit more feedback to know you're doing it correctly. So how many of you are holding your breath when you do it, right? That's not ideal. There's a lot of different breathing patterns that people will use that's natural to them. But in general, we don't want you to hold your breath. We don't want you to feel like you're pushing out as well. And you shouldn't have too many other body parts working at the same time. So if your whole body lifts up when you do a Kegel, you might be using your glutes a little bit too much. So another way to tell if you're doing it incorrectly is if you actually leak during the pelvic floor contraction. So I find this happens a lot of times when people use too much of their abdomen and they sort of brace a little bit firmly, and it can overpower the pelvic floor and contribute to leakage. And the other tip I would give you is not to practice your pelvic floor exercises while you're urinating. So if you want to test the waters and you can't feel that much and you want to see if you're using the right muscles, then if you go to the bathroom, maybe once, try to stop the flow of urine. If you can get it to stop, fantastic, you found the muscles. But that doesn't mean we want you to sit there and practice while you're urinating, because that can throw off your signals to your bladder and that let you know when to pee and when you're empty and things like that. So these are the don'ts of pelvic floor contractions or Kegels. So which kind of Kegels do we want you to do? We have a slow, a quick, and a functional Kegel, or something that is listed here as control. So a slow Kegel is working on your endurance. The goal is to work your way up to being able to hold the pelvic floor contraction for 10 seconds. And that can look something like 2 to 3 sets of 10 daily. A quick Kegel, a quick Kegel would be kind of squeezing and relaxing, squeezing and relaxing. And again, you could do 2 to 3 sets of 10 daily. That would give you about 60 Kegels a day, which is based on general strength training guidelines. But the biggest thing about Kegels is doing them during the activity or right before that makes you leak. So I can't tell you how many times I've seen patients and you guys are doing everything you can to get that pelvic floor working, and you say, I do them when I'm at stoplights, I do them while I'm brushing my teeth, and I'm impressed that you can multitask. But when I ask what's actually causing them to leak, they'll say, well, I leak when I cough, or I leak when I pick something up. Well, we have to implement that exercise during the activity or just before that makes us leak. So we talked a little bit about how breathing pattern is important to make sure the pelvic floor muscles are working well. So you want to make sure that you are keeping everything else relaxed. The abdomen's relaxed, your glutes are soft, you're activating the correct muscles, but you also want to learn how to use the pelvic floor muscles functionally. So maybe you start with doing your pelvic floor exercises in isolation, and you just start to feel them and know where they are. The next step would be doing them in different positions, sitting and standing. The next might be tightening when you go to stand up, or maybe engaging pelvic floor when you go to pick up the trash, whatever activity it is that causes you to leak. So it's essential to have the right amount of force and to engage it at the right time. So a good functioning pelvic floor is kind of like an orchestra, right? You've got to have your pelvic floor muscles working at the same time as your movement. You've got to have good leg strength to support the pelvic floor, and you've got to be able to coordinate your breath at the same time. So you might say that optimal urinary incontinence is about more than just Kegels. So let's practice a few together. There is no glory in practice, but without practice, there is no glory, right? So here we go. We're going to practice doing a 10-second hold. So what I would encourage you to do is go ahead and sit in a position where you're upright, not super elevated, you're not really slouched, you're somewhere in the center, feeling relaxed. I want you to go ahead and close those openings, close the anus, zip that tension all the way up to the urethra. If you're a male, try to pull in the penis and hold that for 10 seconds. And relax. 10 seconds can feel like a long time. If you can't quite hold it for 10 seconds, you can back off and start with 5 seconds, working your way up slowly to 10. Another thing that I will cue patients to do is to take 2 breaths while they sustain the contraction. So you can also try doing the pelvic floor contraction before a cough or sneeze. So go ahead and engage those same muscles, drawing and closing the anus, pulling in the penis if you're a male. Go ahead and close the labia if you and pinch around the urethra. Hold on to that and and then relax. I want you to try that again and put your hands on your abdomen. Try to tighten the pelvic floor. You're pulling a marble up through the vagina, a grape through the rectum, pulling in the penis if you're a male, and hold on to that and cough. Did you feel your abdomen push out or pull in? If your abdomen is pushing out, then the odds are all of the pressure you're generating for that cough or sneeze is going down onto the bladder. So working through a program that could help you strengthen the abdominal wall might be helpful as well. You can try it on your own with contracting before you stand up or before you pick up something heavy. Maybe you go to move a heavy door and you think about tightening the pelvic floor just before and maintaining the tension through the duration of the task. Elevator Kegels are another really great way to improve your overall coordination and sense of where your pelvic floor muscles are at. That's particularly helpful if you're having pelvic floor dysfunction. If you tend to go 0 to 100 and have no ability to grade the force of the pelvic floor contraction. So before we go into the lifestyle modifications and diet, I just want to put a note out there that the point of learning how to do Kegels is not for you to clench your pelvic floor 100% of the time, all of the time. The point of doing these exercises is to strengthen the pelvic floor, but it's also to teach you where the muscles are so that you can tell when you're tightening or relaxing and everything's being pushed out. So I just want you to consider that in your pelvic floor exercise program. All right, so other things. We talked about Kegels. So other self-treatment is dietary and lifestyle modifications. So there are certain things that are called bladder irritants, and that could be in the form of anything with caffeine. So that could include tea as well. Green tea, believe it or not, has a lot of caffeine in it a lot of the time. Coffee, Earl Grey tea, black tea. Carbonated beverages is a big one. The Pellegrino, the LaCroix, whatever you want to call it, those things, anything carbonated can be very irritating to the bladder and give you the sensation that you have to urinate more frequently. And sometimes if we get the urge to urinate more frequently, maybe the urge isn't so strong, maybe we don't have the strength and endurance to make it to the restroom. So doing something that would reduce the intensity of your urge might help you get to the restroom more successfully without having an accident. Spicy foods can be a big bladder irritant. For some folks, tomato-based food, and then anything really high in citrus So that could be orange juice or lemonade, which are very tasty, but can be a bladder irritant. One of the biggest things I see is if people have urinary incontinence, they withhold fluids. They say, well, I'm going to go out and about for the day, so I don't want to have any liquids because I don't want to leak. Dehydrating yourself concentrates the urine. The increased concentration in the urine is also a bladder irritant. So we want to make sure we stay hydrated because it's good for us for a lot of other reasons, but also it's not really helping you in the way you might think it is. Another tip is to avoid drinking large amounts of fluid all at once, because if you dump all that fluid in, you're going to have to avoid it out kind of in a shorter time frame, and that'll increase your frequency for a duration of time. Try to avoid urinating just in case. So another habit that I see people develop is maybe they start off with having a little bit of leaking when they cough or sneeze. Maybe you had a baby. You leak when you cough or sneeze, so you withhold water and you go to the restroom every time you leave your house, every time you get to a store, every time you're going to leave the store. And what that does is that creates a habit that teaches your bladder to want to empty a lot sooner than that 75% mark we talked about. So your bladder needs to be trained. You need to be consistent with it and make sure that you only are urinating when you truly have the urge, which should be 2 to 4 hours apart. Don't wait too long. I've seen a lot of patients, teachers and nurses, I'm looking at you, PTs aren't great about it either, but going long periods of time without voiding can put a lot of strain on your bladder over a lot of years, and that can be not helpful in terms of bladder health and continence as we age. Avoiding smoking. Smoking can lead to chronic cough, which can contribute to increased pressure on the bladder and result in urinary leakage. And if you have an increased swelling in your legs, sometimes I've seen patients that they say, I do fine all day, but I urinate 5 times at night. And I look at their legs and they have swelling. So if you have swelling, address it. What's the cause of it? And one of the things I have my patients do is elevate their legs before bed, and that will help all of the fluid in the legs circulate through the body and through the whole system, so you would urinate that fluid out before bedtime. Another self-treatment would be weight loss. The research does support that being overweight can increase the likelihood of urinary incontinence. And so I urge you to take care of yourselves, look at the diet, look at your habits, and do your best to manage that weight. Because it doesn't matter how strong your pelvic floor is if you've got a significant amount of weight in your abdomen bearing down constantly on that pelvic region. So weight loss can be a really big player. So what can we do when we have this urgency? If I've got to go right now. So some people will just run to the bathroom. Number one, running to the bathroom instead of walking will increase the likelihood of leakage, we found in the literature, and we attribute that to some muscle imbalance in the hips and the legs. And so we want you to calmly walk to the bathroom. So how do we calm this urge down? We can do something called urinary urge suppression. So if you feel like you have to go, and this talk has been going for about 20 minutes, and you know you went right before we started, physiologically you do not have enough urine to void, as long as the anatomy and physiology is normal. And so knowing that information, when you feel the urge, stop what you're doing, stand still or sit down if you're not already, and do some Kegels. So 3 to 5 pelvic floor contractions. And when you do that, it sends a signal to your bladder to relax, and it calms down the urge. Now, depending on where you are in your journey, you may be able to put off the urge for another hour, and you'd be surprised. Or you may last maybe another 10 minutes. And if you last another 10 minutes, then good. You went 40 minutes today without having to urinate. And you can slowly build up that time in between voids over time. If the urge is really getting to you and it's challenging, try to think about something else. Make a list of things you have to do today. What did you need to get at the grocery store? Who did you need to call? What appointments do you have lined up? Something like that. And then when that urge subsides, if it's not so intense, if you still feel like you need to go, then go ahead and go to the bathroom calmly. But like I said, if you can wait, then try to put it off again. You get a second urge, try the same thing, doing 5 pelvic floor contractions, and when the urge isn't so intense, that's when you go to the bathroom. So you don't want to reward the bladder for freaking out. You don't want to reward the intense urge. This slide is to show you what can be helpful. It's called a Bladder Diary. And if you look on the links under the description of this video, you will see several attachments, and one of them is this Bladder Diary. I find it really helpful because when you fill this out, you can learn a lot of things about yourself. One, you may not be leaking as often as you think you are. Two, you may be urinating a lot more frequently than you think you are. And so doing this diary for at least 3 days will help clue you into when you're having the problem and what specific problems you're having. So I have attached in the link, there's a copy of this, and you can fill it out and have this information. If you do this whole program and you don't see the results that you'd like, you could bring this into your healthcare provider and let them know what's been going on. This might give them insight into maybe your issue. So beyond Kegels, where does physical therapy come in? So physical therapy is one-on-one training for strength, endurance, and coordination of these muscles. We help you know how to fully relax the pelvic floor. We can work on addressing any asymmetry in pelvic floor muscle resting tone. We can do, with soft tissue manipulation, we can do biofeedback, whether that's intravaginally as a female, intrarectally as a male, or externally along the perineum, which is the space between your thighs. We can tap that area and cue you where to lift from. There's also other orthopedic considerations. I've had people come in and tell me they leak urine when they go on long walks, and they have a big hitch in their walk. And I ask them, do you have any pain? They say, yeah, I've had hip pain for 5 years. Maybe we address the hip pain so you get better transfer of weight between your limbs, and that takes stress off of the bladder and can eliminate the incontinence issue. So that's just one example of an orthopedic consideration. Pilates-based exercise can be really helpful. There's a lot of moves in Pilates that facilitate pelvic floor contraction. And that's generally the idea, especially in addition with these advanced exercises. We want to learn how to use the pelvic floor muscles, but then transition that into being able to feel ourselves use pelvic floor muscle contraction during other functional movements, like squats or picking up something heavy. Which brings me to body mechanics training. That's something we regularly work on in physical therapy to make sure that you are stacking and positioning yourself to optimally use all of these supportive muscles in the area, your glutes, your thighs, all that kind of stuff. So some adjunct treatments that you might consider that can be helpful we commonly use in our practice at the Pelvic Health Program is acupuncture. Acupuncture can play a really big role in improving urinary urgency. Pilates is a great transition. You've got your pelvic floor exercises down. Now let's implement them in a type of exercise that you'd like to keep going with. There's fitness classes and one-on-one training. The classes aren't really happening right now, but we're working on developing some home training videos that you can implement. But we do have the one-on-one training. Massage therapy can be helpful. Maybe we're weak because there's a muscular imbalance. Guided imagery, nutritional counseling to help with the weight loss. We also have Reiki available, counseling and sex therapy, as well as wellness coaching to really kind of give you the full picture and address all of the issues. So that's pretty much what I have for you today. Let me know if you have any questions. We'll take some time to answer those now. Thank you. I knew this would come up, and I'm glad it did. So the question is, or there's a statement, I have interstitial cystitis. It makes me urinate often. Any advice on that? So with cystitis, interstitial cystitis, for those of you that don't know, is often the symptoms of a urinary tract infection without an infection. And interstitial cystitis can be very painful. And some of my patients who implement that urge suppression, where they try to do 3 to 5 Kegels and ignore the urge, that can increase the bladder pain. So I would encourage you to use that sparingly if you can tolerate it. Some of my patients do well and can get past it, and some people can't get past about an hour. So if you're continuing to urinate more often, you could look at what you're consuming and what you're eating. So we talked a little bit about bladder irritants, carbonated beverages, fake sugars. I see is commonly patients have irritation with tomato-based foods. What else am I missing? Anything high in citrus, spicy foods. But not everybody is the same with interstitial cystitis. Everybody is sort of different. So I would encourage you to try to eliminate the irritants if you can. Keep yourself hydrated. Try some of the urge suppression. If that doesn't help you, I encourage you to talk to your doctor, because physical therapy is the gold standard for treating interstitial cystitis. If you have further questions about that, feel free to reach out to our office and maybe we can guide you further. That's a great question. Next one is, when should I ask my gynecologist about incontinence? Well, if you're having any incontinence, let them know. Hopefully with what I've given you today, you kind of have a place to start from. You can start doing some of these exercises. And if in doing them, you're not getting the results you want, you can talk to your gynecologist about it and let them know that you're having the issue. The gynecologist will check a number of things. They will often check the health of your tissue, your vaginal tissue. If you are peri or postmenopausal, there may be changes in your tissue that contribute to incontinence. So you can talk with your medical provider about what you would do to address that. One thing I'd like to add, there's another tab, a couple of other documents, just while we're on the topic, that you have accessible to you under the description part of this video. And one of them is this 30-day home trial program. So you'll find on here different types of Kegels that are listed. You can write out, okay, this week I did this many Kegels, the slow, the quick, or I'm having leaking when I stand up, so I'm doing sit to stands. I can just, is a way to help you track and know kind of what you did what day. And then another thing I want you guys to know is I have included a bladder health handout. This talks about all of the bladder physiology we discussed. So if you're like me and need to hear it more than once, you can read through that and maybe get some of those lingering questions answered. We also talk about urge suppression on that sheet. And I believe that was all of the handouts that I provided. But yes, I would tell your gynecologist about it. If they tell you to do Kegels, tell them I've done them, because you have, or you will after this video, and talk to them about maybe seeing a pelvic physical therapist. How do I go about making an appointment? So for physical therapy, with Hoag, we require a prescription from your doctor. So hopefully you've told your doctor about this issue. If you haven't, depending on the relationship that you have, you may have to go in for a full evaluation with your medical doctor. Or if they know you have this issue, just say, hey, I think I learned a bit about pelvic floor exercises, and I'd like to go and get a consult and just see what my strength and coordination is like and build a home program to get rid of this issue or to try to eliminate the issue. And they give you a referral. The referral has to be sent to our office, either Irvine or Newport, and then we will reach out to you and we can schedule an appointment. We will check what your insurance coverage is and go over that estimate with you to make sure that there's full transparency. And yeah, just give us a call. On this slide here, you can see the phone number for each location. So Irvine or Newport, whatever is closer for you. Back to this question, is pelvic floor therapy covered by insurance? Yes, it is. And for the most part, at Hoag, we are contracted with most insurance companies. And so it just depends on what your coverage is, will dictate your cost. If you have a really high deductible, oftentimes we can go with a lower cash rate than what it would be if you went through your insurance. That gets a little hairy. So just you can reach out to our front office, either of these phone numbers, and let them know your information. And if you have a referral and want to come to physical therapy, they can look up your benefit. If you want to call yourself, I think that's the best thing, to make it as clear cut as possible so that you have an understanding of what your insurance will cover. But yes, pelvic floor physical therapy is covered just like regular physical therapy. Yeah. All right, thank you guys so much for joining me today. I hope you learned something and feel empowered. You're not alone. So many people deal with this issue, and there's so much you can do about it. Thank you so much for joining us, and take care.